According to the American Cancer Society, an estimated 87,000 new cases of melanoma were diagnosed in the U.S. last year, and approximately 9,700 people died from the disease. A new therapeutic treatment option, though, is now available that may help prevent melanoma from actually coming back after surgery. Dr. Jeffrey Weber joins us with more on this topic, along with Louise Perkins with the Melanoma Research Alliance. Thank you both so much for being with us.
You're very welcome.
Doctor, can we actually start out with a little bit of education on what melanoma is?
Well, melanoma is a cancer of the pigment cells or melanocytes that live in our skin at the junction between the outer and the inner skin, the epidermis and the dermis. And if those cells become transformed and abnormal and grow out of control, they form a cancer, a tumor. And if it's caught early, you can cure it surgically. If it spreads distantly in the skin or elsewhere or to distant organs, those patients may die of metastatic melanoma. It tends to occur in people who have lots of moles, who are very sun exposed, who have red and blonde hair, who have green and blue eyes, and who see a lot of sun or have been in tanning salons. Some proportion is caused by just genes, even in patients who never see the sun, but most of the time it's ultraviolet light, which means the sun and tanning salons.
Well, being here in Arizona, can you give us some of the symptoms that we should be looking out for?
Usually it's a skin lesion that pops up, or it's a mole that's been there for a while that changes. It becomes variegated, meaning different size. It gets raised. It has different colors. It has irregular borders. It may bleed. Those are all the warning signs that should take someone to the dermatologist. And as you point out, Tucson is in a pretty southern climate, so there's a lot of sun there. There's very good weather, and there are a lot of folks who are at risk. So the dermatologist should be kept busy in Tucson.
And I did mention at the very beginning about a new treatment available. Can you tell us more about that?
Yes, with the caveat and due disclosure that my institution and others have taken funds from BMS to do clinical trials that we'll talk about in a moment, and that I personally have taken consulting fees from Bristol Myers Squibb and other pharmaceutical companies. I should point out there's a new class of drugs called Immuno-Oncology drugs developed only over the last 16 or 17 years. And one of them is called nivolumab, which was recently tested in a large clinical trial where patients were randomly allocated to get either that drug nivolumab or its comparator, which is called ipilimumab, which is a drug previously approved in the U.S. by the FDA. And it turned out that in that trial of patients whose melanoma had spread and was surgically removed but were at risk of relapse, this drug nivolumab reduced the risk of relapse and probably prolonged survival and was less toxic. So it was kind of a winner all around, and that led to its approval by the Food and Drug Administration just 6 weeks ago in December of 2017.
Well, this is great news to have on that horizon. And Louise, on top of that, can you tell us about the Alliance and some of the resources also available?
Yes, at the Melanoma Research Alliance, we have a number of resources available to patients. I should also note that we've been supported generously by BMS for both our research and our educational mission. And there's a lot of information there at curemelanoma.org for patients to help them through their journey with melanoma.
Including, I'm sure that people are always asking, what questions should I be asking? What can my family members and caregivers also be educated on as well?
Absolutely, that information is there, and it can be overwhelming when you're diagnosed with melanoma. So having someone like a caregiver to help you sort through that information, sit in at the doctor, can be great.
Well, this has been great information, and thank you so much for the update on the new technology that we're going to be able to use, and thank you for your time.
You're very welcome.
Don't go anywhere. We'll be right back.